I'm from Minneapolis, Minnesota. I was born and bred here, born at St. Barnabas Hospital in the olden days in 1918.
Boy.
I tried to get into the University of Minnesota. I wanted to be a doctor. But I was told that at that time there was a quota for girls and for boys. So I got very upset and went to Chicago into nursing.
Yeah.
And I was at Mount Sinai in Chicago, well, until I got married. And that was the first time I ever saw anything about neurosurgery. This neurosurgeon was called in from Northwestern. He was professor of neurosurgery at Northwestern. You probably know he is.
Lloyd Davies. Yep.
And he came to Mount Sinai and I scrubbed.
Huh.
I stood about 4 feet away from the mail stand. Didn't dare touch anything because he brought his residents, interns, and clerks, and they did everything.
Wow.
But he only came about 5-6 times. The only thing I knew about neurosurgery is they used a drill and a bayonet forceps. When in 1943, when Herb went overseas, I went to the University of Minnesota and applied. And in March of that year, I marched into the University Hospital looking for a position in the operating room. And they directed me to Dr. Wangenstein.
Yeah.
Well, Dr. Wangenstein was very sweet. He asked me my experience, and I had told him I was Dr. Alfred Strauss's scrub nurse in Chicago. Well, he knew Alfred. Everybody knew Alfred Strauss. He said, "Oh, you can work. You can come tomorrow." He said, "And don't bother getting a license. You don't need one." So there were just about 7 of us operating room nurses in main operating room. This is the old hospital. Have you ever been in the old hospital? There were 3 main operating rooms on the 5th floor, and then on the floor below there were orthopedics,
Okay.
and then on another part of the hospital there was ear, nose, and throat. So our three rooms on Monday, Wednesday, and Friday, general surgery worked. On Tuesday, Thursday, and Saturday, neurosurgery worked. And we scrubbed and we circulated. We did everything.
And when you arrived, who was doing neurosurgery?
The neurosurgery, Dr. Peyton.
Yeah.
And Wangenstein was there.
Yeah.
And Lyle French had left, and Jules Levin from Milwaukee was our resident then. And then we just had a resident and an intern and the scrub nurse and Dr. Peyton. Yeah. Well, when I walked in and they told me I would be assigned to neurosurgery, my heart sank because I knew very little about neurosurgery. But Dr. Peyton said, "I will teach you. Don't worry." Well, that's what happened. I think the 3 years that I spent with Dr. Peyton were the happiest years I ever had in an operating room.
Oh.
I subsequently became, operating room supervisor of 2 or 3 places, but nothing like working with Dr. Peyton. He was a gem. He was very patient. He would come into the operating room. His hair was all mussed up. He would kind of, chug along. He'd get into the doctor's dressing room and ask for some tape, adhesive tape, and then sit there and repair his shoes. Now, I wondered if it was being frugal or superstitious.
Yeah.
Because I kind of saw Dr. Wangenstein do the same thing. I think they didn't want to change their shoes. Everybody scrubbed, and he was very, very careful about sterile technique because when you closed the dura, you didn't have the luxury of the big salt shaker full of antibiotic powder that the general surgeons had. They just shook it into the abdomen. But anyway, he was a wonderful, wonderful patient teacher. And I mean, I was only a scrub nurse, and he was so wonderful. He told me I could ask him anything I wanted, because I'd say, "What are you doing now? What are you doing now?" And we we got along just great. But when we were all scrubbed and and ready for surgery, and he said to Sister Margaret Clare, who was our circulating nurse at the time, she was a postgraduate student. Well, he said, "Sister, would you move that lamp over? You know, we only had one single lamp on the ceiling, and all the rest were floor lamps."
Yeah.
So he said to Sister, "Would you move it so that I could see better?" Well, she did. She moved it, but she didn't. She raised it and didn't screw the knob tightly.
Oh.
So it hit Dr. Peyton in the back of his head. And he let out a yelp, looked at Sister and said, "Sister, I'm supposed to be the neurosurgeon here, not you." And the one thing that annoyed him, you know, in operating room number 1 in the main hospital, in the old hospital, remember there was a balcony up there,
right.
but nothing separating the balcony. And if he saw anybody there, that used to infuriate him. These were not medical students. These were just people who walked in on the 6th floor. And there they were, sitting, a whole row of people. He said, "Who are they?" And you know, he had a gruff voice. Because he used to ask them to lock that door or take the door out. Well, finally, they sealed the door so that nobody could go up there.
Yeah.
And the other thing that sort of annoyed him is you could hear the pigeons. In these operating rooms, you know, had windows.
Uh-huh.
And he said, "One of you nurses are feeding the pigeons," because they were cooing outside of the windows.
Yeah.
The only thing we didn't like about Dr. Peyton is that he was a hunter. And God forbid he should get a deer. And then we had to go to his house for dinner. And you know, we were not very sophisticated people. We had never eaten venison or even seen venison.
Yeah.
And we didn't like that. But on the other hand, we went and we were very cordial and everything. And you know, the thing that surprised me, and I didn't know, that he was considered one of the finest surgeons in this area.
Right.
So that many of the staff men and their relatives had him do their general surgery. I was so surprised when we were going to do a gallbladder. I always scrubbed for him. That was the pleasantest day of the week when he had surgery and I scrubbed, because we loved him. We admired him and we respected him. That was what was most evident. Well, my husband came home in must have been in 46. He came home, and that's when I retired, or resigned. And I missed it. I think I was in an operating room, in and out of 39 years.
Wow.
I loved every minute of it. If they would hire an old lady, I would go back to I could learn a lot. I loved it.